Today's episode is an interview with Dr. Kimber Boothe. She's a pharmacist, healthcare leader, and entrepreneur. I invited her to be on the podcast because she uses her voice to advance pharmacy practice and educate pharmacists and other leaders through consulting, one-on-one coaching, online courses, and more. You're listening to the Pharmacist Voice podcast, a journey-style podcast about my career change from pharmacist to voice actor. I'm your host, Kim Newlove. I alternate solo shows and interview shows. The solo shows are about my career change, and the interview shows feature a variety of people who use their voices to advocate, educate, or entertain. I specialize in medical narration and e-learning. If you have a project in mind, contact me through my website, thepharmacistvoice.com. That's thepharmacist with an S, voice.com. Thank you for joining me for episode 35. Let me tell you a little more about my guest, then we'll dive right into the interview. Kimber earned her Bachelor of Science Degree in Pharmacy from the University of Connecticut School of Pharmacy and her Doctor of Pharmacy degree from the Medical University of South Carolina College of Pharmacy. Then she completed her residency training at the Virginia Commonwealth University Medical College of Virginia Hospitals. And finally, Kimber earned her Master's in Health Administration through the University of Phoenix. Kimber has more than 15 years experience in health systems and 10 years experience in the pharmaceutical industry. Kimber is the founder and CEO of the Kimber Boothe Group, where she provides coaching, consulting, courses, and speaking on strategic pharmacy leadership. She calls herself a connector and a pharmovator. Kimber is the creator of the program Pharmovation. It's a course and system designed to accelerate your pharmacy career, advocate for resources, and advance pharmacy practice. She is passionate about spending time on the right things to develop others and deliver strategic, focused results. Her motto is, "Pharmacy can do more with more," and her goal is to help create 50 new pharmacy positions this year. Previously, Kimber led the pharmacy services for a 4-hospital community health system where she drove innovative strategy for the pharmacy enterprise as System Director of Pharmacy. She was also the Director of Clinical Pharmacy Services at Yale New Haven Health. Kimber and I met at the 2018 Metapreneurs Conference in Asheville, North Carolina. It has been a pleasure watching her journey. I'm happy to share our interview. Enjoy. Hi, Kimber. Welcome to the Pharmacist Voice podcast. How are you?
I'm fantastic, Kim. Thank you so much for having me.
My pleasure. Kimber, my guests advocate, educate, or entertain, and sometimes all three. Can you talk a little bit first about how you educate pharmacists?
Absolutely. So, in my career as a pharmacist working in health systems and the pharmaceutical industry, I've definitely been tapped for my knowledge around strategic planning, project planning, and how to do strategic execution of initiatives. And since then, I've been able to launch some programs to help further educate. So rather than just educating within my own teams and my own companies, now as an entrepreneur, I provide education through doing coaching one-on-one, consulting, where I go out to health systems and help educate them and teach them how to do some of these things, as well as online courses that I provide in an online membership. So I'm trying to use a variety of tools to reach more people, to share my messages of what I've learned about advancing pharmacy practice through strategic business planning. And my whole motto is pharmacy can do more with more. And that is really what I'm trying to teach people to do. And I've really enjoyed doing it as an entrepreneur through these methods because I can reach more people and my voice has a bigger impact.
That's great. I think it's interesting that you coach one-on-one and you have this online course platform. You are my first guest that has an online course platform, and I would love to hear more about that. How do people find you? How do they get enrolled in your courses?
Sure. Well, I definitely, it's interesting when I decided to go after this method, it was mostly because this is how I learned, so when I was trying to start off on my entrepreneurial journey, I was taking some online courses and learning from experts. And I really liked the facilitated aspect of it. So it wasn't you just did a course and you didn't have any connection with the instructor. These were really facilitated programs that I enjoyed because you had weekly calls, or even sometimes more than once a week calls with the instructor to really keep you moving on the path. And you just got that connection, and then the community that came from that. So you're not just taking the course in a vacuum, you're getting to connect and interact with the other students taking the online course. And so when I had this interest based on all these requests I was getting, and knowing that I wanted to have a bigger impact, I decided to create the online program. The first program I actually created 6 years ago was called Connector Academy and Connector 101. And it was more general leadership, career development, work-life balance topics, which is definitely a passion of mine. And then it was about 3 years ago, I decided to focus more on pharmacy. And when I created the program Pharmovation, and again, I really wanted to design it like I had experienced with the other programs that I had valued so much. So it is an online 8-module facilitated program. So each week a new module is released. There are worksheets that you do to move through and make sure through adult learning that you're engaging and really using all those principles together to apply it to your own life and move you forward as quick as possible through the worksheets and templates that just make it easier for you. And then there's weekly calls with kind of a peer coaching opportunity where we answer questions, share with each other what has happened, ideas about that week's module, or other things as well around leadership and strategic planning. And then there is an opportunity for people to do one-on-one coaching to supplement that. And that can be about any of the topics in the course, or it can be on other, just general career development topics of their interest with their career transition and planning.
It sounds like they start online with you on the course first, and then they become a one-on-one coaching client. Is that correct? Or does it ever work the other way, where they're one-on-one with you first?
It's definitely a variety of ways that people come in touch with me. And so in terms of how I market, I do have a website where people will come, and I do offer some, my goal is to get the messages out as much as possible through a blog and podcast that I have called The Connector Life, to share these topics of leadership and engaging and advancing healthcare strategically. People can sign up to connect with me to get regular communication from me about these opportunities, and they may do that long before they actually decide to invest and enroll in one of my programs. But I've definitely seen things happen both ways. Even if I'm speaking at an event, somebody will reach out to me maybe to coach them, or they may invite me to a consultation where I actually go into their organization and help them. So to differentiate a little bit, and I think sometimes even, especially when you have a pharmacy audience, sometimes we think of pharmacy consulting as more the direct patient care, like MTM consulting, or even the American Society of Consultant Pharmacists with long-term care. When I use the term consulting, it's more of the business consulting, where you're working for somebody on an independent contract to provide services over a certain period of time. And I've definitely enjoyed doing that, but there's still, what I like about the courses so much and that opportunity and ongoing memberships is I can reach more people. There's so much time you have in the week, in the day. And if I'm spending it all with one, consulting customer and client, or one coaching student, what bigger impact can I have by using my voice if I'm talking to many at one time? And that's why I've liked the courses. And again, you get that benefit of the community growing together as well.
That was a fantastic answer of how you use your voice to educate pharmacists. That's wonderful. Hit the nail on the head. What I want to ask next is, where can people find you if they want to learn more about you and your online courses? What's your website, and how can people connect with you?
Sure. Well, definitely my website, it's my name. It's kimberbooth.com, www.kimberbooth, KIMBERBOOTHE. A lot of people leave that E off, com. And on there, they can go to the contact page where they can have all my information, my email, my phone number, as well as a way to book an exploration call. So they can go on and schedule an exploration call just to get to know me, for me to get to know them, to see how I can support them in their journey wherever they are. They can also sign up to receive regular emails from me or get one of my tools that I have available, like a personal development plan template that they can just download and get started seeing how I do provide education and see if it works for them.
Very good. And you and I had a conversation a few months ago where I believe we were in the thick of getting started with COVID, and you had some free resources available. Would you like to talk about
Yes.
those?
Oh, true. Absolutely. So, definitely when COVID started, I was connecting my expertise with strategic planning and very organized. When they say about discovering your strengths and stuff, there's times where that strength for me of being organized and very strategic was helpful. And so I created some specific strategic planning assessment tools around how to prepare for the coronavirus, how to do a checklist to see if you're ready, and then how to also plan and what aspects of how you can be strategic about planning for the initial, of course, response to the COVID, how do we do this recovery and transformation that we're in right now. But unfortunately, we also have to be planning for the next wave. And so I follow the CDC guidance of planning for the waves of a pandemic. And while there's definitely a few cities still in this country that are dealing with surges from the initial longer wave, we do have to be prepared for what might be happening this winter. So I've been able to work with some specific consulting clients and help them through their incident command process. And we actually have an article that's been submitted to be published on this topic about the experience at that one organization. But I've been able to help others, get organized about it. I advocated for creating a separate pharmacy incident command structure that was within the health system overall incident command, because this is just such a big topic and we just needed to get organized about it and couldn't rely with all the things that happen within a pharmacy enterprise. We couldn't rely on just the system incident command. We needed to really outline it and be organized. So thanks for bringing that up. It's definitely, I wish it was going away, but I do think we have to continue to be prepared. And even if it's just planning to be ready for the vaccines and the other treatment modalities that are coming, as well as all the impacts on our workforce.
What a timely topic.
Yeah, very.
Let's talk about ideal clients and target audiences. When it comes to your online courses, whether it's the COVID topic that we just discussed or the Pharmovation courses, can you discuss who your ideal clients are and your target audiences are?
Sure. Definitely, and that's a big part, when you're going to design something to create and answer a need, so definitely people were coming to me with these kind of questions already. And when I sat down to think about, at what level am I creating this course and to what extent? So I really, wanted to make it a comprehensive course, and I definitely got feedback from other people. But my main target audience is definitely current and aspiring leaders in healthcare systems. And of course, the healthcare systems are growing these days, and they have all different arms. So whether you are working on ambulatory care services because of all the additional connected physician practices that are now part of health systems, whether you're working on the acute care services, or some other new initiatives that are happening in health systems with home infusion, specialty pharmacy. So pretty much anybody who touches the health systems enterprises. And it is for pharmacists mostly, definitely for my podcast. There are folks, and I have coached, respiratory therapists and other, services, physical therapists. I've coached people in healthcare, again, around this strategic planning to lead. Most of my examples are around pharmacy and healthcare, the health systems themselves and how we integrate. But there is, health systems are doing retail pharmacy and other aspects. So it's a pretty broad range of topics that are discussed because the health system enterprise touches so many aspects of pharmacy practice. It was interesting, when I first was getting feedback from people about the program, and of course, you share your outline, you get kind of peer and potential student feedback to make sure that you're creating a thing that the audience needs. And I was actually surprised. I did have a lot of directors of pharmacy who were interested in my program, and that actually did surprise me at first. And I think it's just what tends to happen is, depending on, sometimes you get into leadership roles where maybe it was accidental, maybe it wasn't, on purpose, or you hadn't really gone through official leadership training, that you are now in a leadership position. And so I have been surprised by having higher people, higher leadership roles within pharmacy, taking my program. And I do think it serves a niche. There's definitely, in pharmacy, I think it's interesting because we do have professional organizations, right? So I'm not trying to replace APHA or ASHP or ACCP. I'm trying to supplement what they have, again, through this integrated connection with me and the community of students. And I call my students Pharmovators. So the program is called Pharmovation. You are a Pharmovator when you take my program. So you connect with those other Pharmovators, and I think it supplements some of the other great tools that are being provided by our pharmacy organization, but and through this unique interaction and community that you get.
I love the word you just used, because the word community means that they're getting to talk to one another, possibly.
Mm-hmm.
Now, how do you
Yeah.
connect them? Do they talk on a Facebook group, or is it through your online course platform? How does that work?
Yeah, so definitely through a community program now, in terms of an online program. I have switched it actually to Facebook. It was within my course platform, but with feedback, more people are just in Facebook, and whether you love it or hate it, it's just a natural fact. It is a little bit easier to interact. So the community part of the program used to be within the course platform. It's just people weren't there every day. They were in there when they were doing their lessons and going through the worksheets, listening to the videos. But I did, for this last session, which we are just wrapping up now, this last 10 weeks of the program, it was on Facebook, and it did support better interaction. But then we have weekly calls. So we meet Thursday nights at 8 p.m. That seems to be, over the last few times I've run the course, the best time. And so there's peer discussion and sharing that happen there. And with that, because of that interaction, now technically we're ending, right? We finished it. The Facebook community will still be available, but after the course is over, there weren't scheduled any more sessions. So I am planning, and there's support from my students, and I'm learning about how to convert it to a membership program where you take the course, you have that intense, 8 modules over, 10 weeks, because we do a break, and there's a mindset bonus at the beginning of the program. So it takes about 10 weeks to go through the program. But it's intensive, and you may not be able to finish everything during that period of time, or maybe it's not the right time for you, right? Maybe we've taught you how to write a business plan, but we taught you how to write a strategic plan to plan for your year, but that's not when your organization is doing it. So let's come back together and meet on a more regular basis. So my goal is to create and have my current students do like a founding membership. So we'll have a Pharmovation membership that will start. And then the program Pharmovation course again will be offered again in January. And then I'll hope to get more people involved with the membership so we can just continue the learning and development, because again, I've always enjoyed that part of the courses. I've gotten the most benefit of courses when I could have that interaction both with the instructor and the other people taking it. So I know long answer to your question, but definitely an online platform, and then the calls that are, facilitated with Zoom, Zoom webinar type meetings these days. And again, I'm happy that I'm going to be rolling this out. It doesn't have to be perfect, but I think there's a desire to continue that. And I definitely hope to have and welcome more students, pharmovators, into the Pharmovation course in January.
This sounds like you have a lot on your plate. Is this your full-time job to do this, or do you work as a pharmacist outside of this?
Good question. I am luckily a full-time entrepreneur now as of January this year. So it is my job, I guess, to do this. And I've been an entrepreneur really now for 6 years that I formed the Kimber Boothe Group and kind of created it and decided that this was going to be something I'd want to do. But I was doing it as a side hustle for the longest time, and of course, wasn't able to fully grow it. In the midst of those 6 years, I did relocate to a new city, and of course, prioritizing my new role. I was the system director of pharmacy, so of course that takes some time, especially in a new role, new responsibilities, broader than my prior role as just the director for clinical services. So it was all wonderful and really, I would say, actually set me on the path to focusing on pharmacy. So I can maybe talk more about that. But I had been working on this as a side hustle. I had a plan to transition in like 3 to 5 years. And I was working with some other entrepreneurs, pharmacist entrepreneurs, and actually went to Blair Thielmeyer's. She had a mastermind retreat last September. And through working with that group of women, Sue Paul, who's a great friend of mine who I'd met through Metapreneurs, which is I know where you and I met, those experiences, those interactions with other entrepreneurs really have set me up. When you say you have to surround yourself with like-minded people or people who are thinking more proactive than you, and that group definitely encouraged me to set a date and to move it up. Because for me, and I think you heard me mention before, with my motto of pharmacy can do more with more, and working with one health system was great, and I was able to add over 50 positions to that one health system through multiple business plans. And for me, it was like an experiment in a way. Like I replicated what I was able to do at my health system in Connecticut, where I added over 50 positions, really about 70 positions, and then was able to replicate that. And that's when it all just clicked that this is what I want to focus on. This is my passion, my purpose. I've always been very pro-pharmacy. When it came to, I created a pharmacist group when I worked for Bayer Healthcare, when I worked in the pharma industry. So I really had this desire to do it. And so basically things aligned between having consulting clients reaching out to me, people wanting to take my online course, one-on-one coaching clients, that there was enough there that I can make the leap to full-time entrepreneurship without a guaranteed paycheck. So while that did cause some angst within my home life, some nervousness, it has worked out amazing. And it's been a fantastic year. I hate to say that for us, like it was just the fact that I could work from home during this time has been amazing, but yet still contribute to responding to the crisis this year. I just feel so lucky, and I'm trying to give back in any way I can. But yes, full-time entrepreneur, and I'm glad I did it. It definitely helps to have other people who understand where you're at and who have done it to help encourage you that you can do it. And it's been very exciting.
Congratulations on your success. Much deserved congratulations.
Thank you, Kim.
You're welcome. You're doing it right, and I know what you mean. We do have jobs where we don't have to work in the public and among people who might be coughing on us, like traditional pharmacy. And I know what you mean by feeling conflicted. You appreciate being able to work from home, but at the same time, you recognize and appreciate what other people are doing outside of their homes. So much respect to all
Yes.
pharmacists out there.
Absolutely. And I was getting ready, I was calling the health systems here and saying like I can come verify orders or, do something. But luckily, at least in the city where I live here in Cincinnati, it didn't really surge that badly. So actually there wasn't as much of a challenge. Unfortunately, in Kentucky, we've had more challenges of having too few patients in some of the hospitals and some hospitals needing to furlough. But I was ready to step up, but also thinking about if I can help again more with the readiness and making sure people, the health systems that are facing the surges are ready and adjusting their staffing and responding to all the aspects that are needed to in a crisis like this.
Let's move on to talking about how you use your voice to advocate.
Sure, absolutely. So I know with your focus of education, advocacy and entertainment, definitely covered the education and now advocacy. I like to think I entertain, but not really. I like to keep it fun though. So that's like with the community we were just talking about. I definitely want it to be fun. And actually, one of these days when I have a live event, I do plan to have like a live actual event with my Pharmovators. I do plan to have dancing, right? Because I just love to dance. So that will be coming. For me right now, for advocacy, I think of both the advocacy that we do within our departments, within where we work, and how do we advocate to leaders for the role of pharmacy. I also think about how we just have to advocate broader with our overall profession, with our involvement. And then the third way I've focused a lot on advocacy is connecting beyond pharmacy. So I've been involved with the American Council of Healthcare Executives, attending those programs, speaking actually at some local programs, both with ACHE and some of the state hospital associations. You're just trying to share the message. Again, my motto is pharmacy can do more with more, and that message works well, I think, within pharmacy. I do think it can scare some non-pharmacy team members because they just hear, oh, you just want more resources. Well, I want more resources for pharmacy because we can do more. We can help you, healthcare executive. We can help solve the triple aim. We can help improve patient outcomes. We can help improve their experience and ultimately reduce costs. So while we will invest in having pharmacists and pharmacy technicians involved in these integrated care teams, we can advance pharmacy practice, which again ultimately improves the triple aim, which addresses a lot of the concerns that they have. And so advocating for their support of pharmacy, speaking, and being more bold. So a main part of what I've seen is pharmacy is we're just often asked to do more with less, so it's just the opposite sometimes. And while I definitely believe in efficiency and finding ways that we can do more with less, there's definitely the top of the license type practice that I want to encourage, that we pharmacists are only doing what they absolutely have to do. Technicians are doing what they can do technicians can do way more than usually what they're doing in our organizations. And then we're optimizing technology to do everything it can. I'm a big supporter of AI and some of the transformational technology. Some of that is what brought me back from pharma to health systems, because I really wanted to work with health IT and health informatics where it can improve patient outcomes and population health. So making sure everybody's practicing at the top of their license is critical. But we are often, I don't want to use the word victims, but it's just sometimes we are too reactive. We're definitely, as a profession, want to encourage us to be bolder about advocating for our role and not do more with less. Again, I know I speak mostly with health system pharmacists, and my own experiences, they're going to open a new service line in the health system, or they're going to open a new building, or they're going to treat whatever specialty, they're going to do bariatric surgery now, or they're going to treat cancer patients in this new service line. we need to make sure we have enough pharmacists when that happens. And then in the ambulatory side too, we're way understaffed for what we should be doing. I'm glad to see, very proactive organizations to create what I think is the best model. We should have one pharmacist per every certain number of doctors. And I think the best ratio is we should have one clinic-based integrated pharmacist for every 3 primary care offices. And so we need to advocate for things like that. And many health systems don't have no pharmacists whatsoever in their ambulatory clinics. Even in this day, we just need to be more bold to advocate for those things within our organizations, in our departments, to ensure we can solve these medication issues. Going back to like when I started this 6 years ago, and I thought about what my strengths were, and definitely all of this stuff I've been talking about, career development. People came to me for coaching all the time. How do I get to the next level? What do I need to do? Strategic planning, project management, execution. Those are my strengths. And so that's how I started my business. And then 3 years ago at Metapreneurs, again, thinking through that stuff again. And when you ask the question, what keeps you up at night? What is your pain point? And for me, it's like, I'm in this profession and we just have way too many medication errors. And we equate it to airlines and airplanes crashing, and it's scary what still happens. And I think part of it is we don't have enough pharmacists integrated in the process. They don't have enough knowledge. Our community pharmacists have limited data to be able to truly impact because they don't have all the information. We're not reimbursed the right way to ensure we're part of the care team. We don't have provider status. There's so many things that are keeping us from achieving goals of optimal patient outcomes with medications. And so those are the things that were keeping me up at night that I wanted to try and address. And the other thing related to that moving, I started that program, I was still on the side, and going back to what you were asking me about with my journey, for me, the pull then for me to move out and be an entrepreneur and have a bigger impact was some of the concerns we have in our profession right now about saturation of having too many graduates and maybe not enough jobs. And when I look at all that other data of these unmet medication needs, not achieving the triple aim, all of these challenges, and knowing that pharmacists could be that, that's what pulled me in a way towards going out there more, because we need to increase the demand for pharmacists. We really can. There should be a bigger demand, but people don't always know it. So again, looking at advocacy in a lot of ways, I see that both coming from within the profession, because the leaders right now, they're saying, okay, they're planning their fiscal year 21 budgets. They should be getting more pharmacists. They should not be getting less. With the pandemic, we need more pharmacists. It's just an additional reason, but they probably didn't have enough pharmacists to begin with. And it's making sure we advocate to the leaders in our organization and leaders beyond pharmacy so that we don't have to keep fighting for it. It should just be a given. You're opening your clinic, you're opening this service line. You should have one pharmacist for every certain number of doctors. In the inpatient side, I say you need one pharmacist for every 20 ICU patients and one pharmacist for every 35 floor patients. And in the ambulatory setting, you need one pharmacist for every 3 primary care doctors. That should just be a given. And I want to get to that point, so it's just automatic.
You have some great ideas. I have never heard anybody assign numbers to them, and there must be a reason for that. Does that have to do with this triple aim that you're referring to? Because I am unfamiliar with triple aim.
Sure. Well, the numbers I think come from trying to compare it to some other practices, medical practices. They have panels or a certain number of ratios that's considered safe for how many patients they can take care of. Definitely the triple aim, or now they are actually calling it the quadruple aim. Some of it, came from the Institute for Healthcare Improvement, as well as some of the advances we've had in their healthcare system and insurance wise, just thinking about those needs. And so the three part, what used to just be the triple aim is again, more quality outcomes, ensuring quality outcomes, patient experience, and value, financial. And now the quadruple, the fourth one that's been added, is provider engagement, preventing burnout, et cetera. So even that, which I do definitely agree and have some examples of how pharmacists can help reduce provider burnout while also reducing our own burnout, is important. So we can address that. The reason I talk about the numbers a lot is, definitely I teach a lot about business planning and how can you show a return on investment, ROI, with adding pharmacy resources. I like to use the numbers because in other groups, like even in physicians, they have a certain panel size. Like one doctor, on average will see about 2,000 patients in their panel. And you just know that based on that mix of patients, they will see, the highest risk patients, they may see them 4 times a year, or they may see them more. Lower risk patients, they're only seeing them once a year. So there's appropriate amount of time based on visits. In the acute care setting, nurses have very clear ratios. Like it's one nurse to every, 2 to 3 2 patients if you're in an ICU, 4 or 5 patients on a floor. So for nursing, it's very clear. As soon as, if you were to get to, if you have 2 nurses and 10 patients on a floor, you're good. As soon as you get the 11th patient, you need a 3rd nurse. It's just like that. Respiratory therapists, it's the same way. They have it in their national standards to say that one respiratory therapist, now we're going to forget the number, it's around 10.
There's a number.
10 patients, I think, on a day that they can take care of. And it's in their guidelines. So when they're staffing and you're looking at the trends and, okay, we now have 11 patients, I need another respiratory therapist. And for pharmacy, it's like a pharmacist in a hospital, acute patients, very sick patients can be taking care of 75 patients. And what can you really do when you're taking care of 75 patients beyond just being very reactive to the crises? We can't achieve, continuity of care. And the same goes on the ambulatory side too, because some health systems will have one ambulatory pharmacist for thousands and thousands of patients and hundreds of primary care doctors. And we can pick and choose, we're going to take care of the patients who have a hemoglobin A1C greater than 10. And that turns out to be, 500 patients. Okay, so one pharmacist is going to do that. But there's all these other patients over here who have all of these other challenges. And I do want to mention, of course, I'm definitely a firm believer in prevention as well. So definitely try and advocate for pharmacist involvement with annual wellness visits. How can we be involved in preventative? A lot of pharmacy is about treating, after you're sick and treating. But whether it's, functional medicine involvement, using pharmacogenomics and nutrigenomics to better plan and stay healthy, I think that's a growing opportunity that I'm definitely interested in making sure that we advocate for pharmacists to be in.
This has been a fascinating topic for me. When you talk about numbers that are assigned within a health system, respiratory therapists, nurses, what have you, I had never really thought about how anyone assigns the number of pharmacists to a health system,
Mm-hmm.
or even community practice going, outside the
Yeah.
health system. I know you focus on health system pharmacy,
Yeah.
but I come mostly from a community practice background. And when I think about my 9 years in community practice, it never made sense to me how the pharmacy was staffed. When you have the 2 shifts, you have maybe a 2-hour overlap, any number of things could happen. It could be the Monday after a
Mm-hmm.
holiday. And as a pharmacist, you know what that means.
Yeah.
There's probably stuff that was closed on that Friday and you're catching up. It could be seriously the busiest day of the year. If the 4th of July,
Right.
for example, was on a Friday, then good luck, Going back to those days, Like I said, any number of things could happen. Thanksgiving's always on a Thursday, right? A lot of
Hmm.
doctors' offices are then closed Thursday, Friday, of course, Saturday and Sunday. When you come back that Monday, I can't remember if that's the busiest day of the year, wouldn't doubt it. And that's right during flu shot season, right? Any number of things could happen. People could be coming in for prescriptions that they called in that didn't have refills. And of course, the doctor's office has not had a chance to address that. And they want their prescription, they want it now, and they want their flu shot, and they don't want to wait. And the staffing is, I don't know. I mean, if the pharmacy manager's on top of things and they can get the hours, that's great. But if not, these busy days can happen any day of the year. People could just
Hmm.
decide, I need my prescription. I need it now. There was no holiday
Hmm.
associated with it. I need my flu shot. I need it now, or I need whatever kind of immunization. How does anyone staff for that? You just don't know, and I don't know if anybody out there is trying to address that, and I'm sorry if I'm speaking out of term, but
No,
I'm sorry if I'm speaking out
absolutely.
of turn, but yeah, I'd love your thoughts on, do you happen to know if community practice is addressing these numbers too?
Well, it's definitely come up. And of course, like I said, while I've worked in community pharmacy, definitely did that during school myself. And as being a health system leader, because we have I don't like to call it retail, but outpatient pharmacies, I have gotten more involved with that. And then I've talked to other leaders though, like, what is the metric? That's what I will say is, what is the metric? And so I've mostly was giving examples of more like clinical service, but it definitely applies to operations and just in general, just pharmacy practice, overall, that we need to know our numbers. We need to know what the right ratios are, because people will come and talk to us. One of the bonuses that I actually added to my Pharmovation course is called budgets and benchmarks, because benchmarks, it's good we have to know it, because otherwise at some point somebody else is going to come to us and tell you how you should be staffed. So whether it's the corporate leaders in a retail corporation, or it's other non-pharmacy leaders telling you this is how much staff you need to know it. I've definitely asked the question though for community pharmacies, what is the right safe ratio? How many prescriptions, when you think about the counseling and the enhanced services we're trying to do, like what is the right number? And I haven't gotten that.
You've
I
asked the
I'm
question though?
surprised. I have asked it of multiple leaders of our, chain pharmacies, and I've been surprised. So now I feel like we have to do that kind of research. I definitely need to make sure with, the leaders that I'm trying to support, that they understand that for their outpatient pharmacy. They also need to know it for their own operations. And the clinical service, so we need to know for all of the things we do, and we do very unique things. Like you said, it in some ways it has become harder than for nursing, because the ratios in terms of the mixture of different activities that we may be doing in different practice settings, that was the one feedback that I've heard about community pharmacy. Well, it's hard to compare. It's apples to oranges, because one pharmacy may be doing MTM and other stuff, and one pharmacy may maybe not. I don't know. I think there's got to be a way to find that answer. One thing with COVID and the coronavirus response for staffing was, there was a big change, and we learned this from New York early on. And even in pandemic preparation, when you think about how to do scenario planning, you want to plan for an increase in census. And most places were saying, if you have a 150% increase, so you increase your total census by more than 50% or 150%, so you're so much higher than you usually are. The biggest change was in the ICUs. So when New York had this experience, it wasn't necessarily on the floor. It's just there were so many patients in the ICU, sometimes 150 to even 200% of their normal ICU capacity. And so the big thing that I was speaking about, especially during the surge on some of my LinkedIn lives, or my posts, were talking about that staffing though for an ICU patient is very different than staffing for a floor patient. Like, we need to know that, but we do have to advocate for that. And some people don't understand that. Oh, well, the total census in the hospital is down, so you should be able to have less staff. That's not true when you now have so many more ICU patients who are on more meds, higher acuity monitoring that are needed. They need more meds made for them. There's so many aspects there. And so sorry, just throwing that in as a side note, just because understanding your data. I mean, that's a big thing that I talk about in my courses. Like, we need to know our business. We need to know the numbers and the data, and we need to advocate for the right staffing. I definitely don't want to overuse resource, because I don't want to waste. I do, like I said, part of the quadruple aim is cost management, and that can include wasting resources. I don't want to just add people unless we're delivering value, and we usually are.
Great discussion. Thank you. Well, let me switch to a couple of lighter topics and then we'll start wrapping this up. How's that?
Sure. Yeah, absolutely.
What's your biggest challenge as an entrepreneur?
Good question. And I think it's probably changed as now I'm a full-time entrepreneur compared to when I was a part-time entrepreneur. When I was doing it on the side, I would say, my biggest challenge was the time, making sure, I was allocating an appropriate amount of time that wasn't going to, burn me out. I wanted to start things and establish them, but I also, of course, needed to spend a lot of time on my day job, my career, my main part of my career, and that was great, and that was going well. So it was just the challenge of trying to decide, how much time. I do have 3 kids, so there's the balance of family life, your health. I do actually talk in my connector program about the 4 quadrants. I have an image, and I think about my career in the 4 quadrants of myself, my career, my family, and then community actually is my 4th one, but more like where you live. Are you volunteering? I volunteer with my church. I volunteer with a trail organization. So I try to make sure that those 4 quadrants have balance. And when your career quadrant is taking up more space because you have a side hustle, that was, a balance. So I was investing the time and planning for future. So that was the biggest challenge then. Now, as an full-time entrepreneur, I would say my biggest challenge is somewhat staying focused, right? Like, when you're an entrepreneur and your day is your day, you can plan, you can go after different initiatives, you can create new programs, and you could get into going after things or spending time on things that are not, at the end of the day, the most valuable or in line with where you're going. So my biggest challenge is making sure I do stay focused on my ultimate goals. And so that is my biggest challenge. I think it's working well. And again, that's where being parts of other groups, other programs where you are talking to other entrepreneurs, getting feedback. Recently I did talk with some folks, and I wanted to create a group for other pharmacist influencers, people who are marketing to pharmacists, who are like me, who are, creating programs for pharmacists. They're their clients as actual pharmacists, and trying to get this group together, so that we could share. And I wasn't sure if I was going to do it. And I got some feedback because I was like, well, is this really with my mission of helping to advance pharmacy practice and advocate for more roles and resources? And, I did get, some feedback. It was, at the end of the day, if I help other pharmacy influencers who are doing similar things to me, maybe they're marketing, or, they're working more with people who are in community pharmacies, or they're doing one-on-one, career coaching. If I pull that together, it does actually support my overall aim. So that is something I am doing right now, and does fit. But there are definitely other things that have come up. I've had, and people have tried to hire me now to work for them, and that's kind of an easy no, because I want to stay independent. I'll be a subcontractor with some of the bigger consulting firms, but I don't want to be an employee right now. So those are my differences with my challenges in my journey.
Yeah. Well, it sounds like you have properly identified them. It can be difficult to stay in your lane when people offer you these other opportunities. You really have to stop and think, is that what I do? Is that what my company does? I feel you on that because I've had people ask me to do certain things and I think, "Oh, that's a really neat opportunity," but I have to turn them down because that's not what I do.
Yeah, absolutely. Yes, I go back to my mission, and I did create a goal this year. Originally, actually, when I announced in December that I was going to be a full time entrepreneur, I said, my whole pharmacy can do more with more motto, of course, continues, and I said I'm going to create 25 new positions. I'm going to help create 25 new positions in 2020. I was like, I should have called it 20 and 20 positions in 2020. What I did was 25. And I actually did that within the first quarter. I actually created like
Way to go.
32 positions with working with one group. And then my students who are taking my course are creating positions. And I've submitted additional business plans working with folks. And so now my goal is 50 for the year, and I definitely am on track to meet that. So I'm trying to create. I haven't solidified the number, but I want to at least add like over the next 5 years, hopefully like 1,000 new positions for pharmacy.
Wow.
Um,
Now, when you say pharmacy can do more with more, you mean pharmacy can do more with more pharmacists in the game, right?
Yes, yes. And it's pharmacists and technicians. So I think the reason I do say pharmacy and not pharmacists is I am thinking about the team, so I do think we need both so that everybody is practicing at the top of your license. And when I say more with more too, I think about roles and resources. So creating those new positions, whether it's the frontline, we need more people taking care of team members. Maybe we need a medication safety officer person. We also need resources too. So it might be the technology. It might be that we need the artificial intelligence tools. So it's when I'm helping people, there's actually two different modules in my program. One is for services, and that's the people and what you're doing. And then there's technology. So it's, what technology do we have? Do we have that robot that's filling the prescriptions for us? Do we have an automatic barcoding system that's going to check a medication tray for us? Do we have the technology to help us with our population health? So I'm trying to advocate for both the people and the number of positions as well as the technology that will support us doing that.
Thank you. That makes a lot of sense. What's your favorite thing about being an educator and having online courses? I think you mentioned it a little bit earlier, but I just want to give you a chance to say it one more time.
Sure. I mean, definitely my favorite part is connecting with people and being able to share my voice with more people to have a bigger impact. The reason why I've always enjoyed career development is seeing the results of the people that I have mentored or coached, and now seeing it through my course and seeing them not only developing in their careers, but also advocating and creating business plans that they've added new positions, new programs to their own people. So being able to have a bigger impact than what I can have myself, supporting them, seeing them grow has been what I've really valued in this overall experience.
That's awesome. Thank you for sharing that. Can you tell me something that people may not realize about leaving a traditional pharmacist role to pursue a role of your own choosing?
It is a little scary for sure. It is a lot of work. So I will say it's interesting because somebody did approach me for coaching, and they wanted to leave their hospital job to be an entrepreneur and be independent. And working with that person, realize that what they really didn't want to be an entrepreneur. They really just wanted to advance their clinical practice and actually just serve in a different way. They were more in a more non-direct patient care role in pharmacy, and they really just wanted to be in direct patient care. So working through that, I'm not trying to discourage people, but there just definitely are a lot of components that you have to do. So to think that if you become an entrepreneur that you're going to just get to work on things you like to work on is not really true. So it's true, I can choose kind of which clients, I work with. Like somebody at first, wanted me to work on their inventory, supply chain. Like, that's really not my focus area. If you need me in this kind of area, that would probably be a better fit. So I can kind of like turn things down like that, knowing that if I was actually at the hospital working as a leader, I'd probably have to make sure I was doing that. But now as an entrepreneur, I can turn down different topics. And the course I create is of my choosing based on the needs that I see. So it is a lot of work, a lot of different pieces. It is rewarding for sure. And what I've been trying to get better at, and in learning from other entrepreneurs, is hiring, whether it's virtual assistants and other team members. So continuing to get better at that, of me practicing at the top of my license, if you will, my capabilities, so that I am focused on my business, on what I am uniquely qualified to do, and having other team members. But that's hard to start with that. Most of the big entrepreneurs that I follow do say they wish they had done that sooner. They wish they had hired a person and stuff. So I definitely have some support, probably not as much as I would like or need, but it's definitely a journey. So I'm in that. So again, I'm not trying to discourage people from being an entrepreneur. I just thought it was interesting in working with this one person that sometimes just being an independent entrepreneur is not necessarily the right thing. Sometimes you can be an advocate within your own organization. And the term that we tend to use, and I have a lesson on this too within my program, it's the difference between intrapreneurship and entrepreneurship. And I feel like I've always been an intrapreneur, right? And it's really all that is kind of having entrepreneurial behaviors, using those skills, those attitudes, to be more innovative in your practices. But you don't have the risk in some of the challenges of being a separate entrepreneur. You're doing it as an intrapreneur with an organization. So I think the more we can support people to be intrapreneurs, and I've definitely had a lot of success with that and enjoyed it, but had this opportunity to expand my voice and use it in a broader way, as an entrepreneur.
Very good. I'm glad you brought up the intrapreneurship piece, because really that's what you're doing. You're helping pharmacists in health systems be intrapreneurs.
Yes.
In a way. Yeah.
Yeah, absolutely. And I am surprised I didn't bring that up earlier, because that is the key thing. Is I'm trying to teach and support people being innovative, and entrepreneurial spirit within their organizations. Because at the end of the day, like in my mind, although this gig economy and people doing things, it's growing. At the end of the day, most work is still going to be done in corporations and in businesses. And you're especially with healthcare, I mean, we're still going to have hospitals and health systems. Patient care is not going to just be provided by a bunch of independent entrepreneurs. Like, I just don't see that happening in my crystal ball of when I'm doing my strategic situational analysis. So I want to make sure we're helping those. While entrepreneurs have tapped me and wanted support from me, most of my audience, as you were talking about before, my target audience of who I want to support are people working for organizations. I've also helped, I've actually, luckily, and again, I appreciate this opportunity to be on your podcast and participate in Blair Thielmeyer's Pharmacy Elevate Summit, where I did talk about how independent pharmacists who are trying to do MTM services, how they can work with health systems, because I do think that's a potential opportunity for on both sides, whether you're independent or you're the healthcare leader. One way to do it could be to hire MTM team consultants who are maybe not employees, but you're advocating to add that resource, whether you're an employee or you're a contracted independent contractor. So I do think there's some opportunities there as well to grow, especially in the ambulatory setting.
I've learned a lot talking to you. Thank you for sharing all this. Is there anything else you'd like to talk about before we wrap this up?
No, I really, again, appreciate this time and opportunity to share my voice on this podcast. It's definitely been my goal and vision, mission of why I've made this step to be an entrepreneur. I appreciate that you've shared, how people can connect with me and going to my website at kimberboothe.com/contact. I'd love to chat with you again if you just want to set up an exploration call to see how I can help, or just sign up so that I can send you more information as I share my regular updates. And the program will be coming soon. The Pharmovation program will be coming in January, but I'd love to stay connected with you before that. My last final message, pretty much whenever I am ending a talk, is really just reminding people to be bold, accountable, and to advance pharmacy practice. We are the answer to the quadruple aim, and I just want to encourage you to be bold and positive.
Thank you, Kimber, and thank you for being on the Pharmacist Voice podcast.
Thank you.
Thank you for joining me for episode 35 of the Pharmacist Voice podcast. Visit thepharmacistvoice.com to subscribe and read the show notes. That's thepharmacist, with an S, voice.com.